for simplifying, for learning the surgical anatomy of the nose, we can divide the nose pyramid in the three part. So upper one third and the middle one third and the lower one third. So this entire nose pyramid we can divide in the three part: upper third, mid third, and lower third. So each third part of the nose that have their own important inner framework. Like the upper one third, this bony vault have the consist by the nasal bone and the surrounding important attachment. And this mid vault that consists by a pair of the upper lateral cartilage. And this lower vault that consists by a pair of LR cartilage. And from the top to bottom, we have the bony septum, then the cartilaginous septum, and the membranous septum. So this is the inner framework of the nose. These all third part, all three part of the nose, they cover by a outer soft tissue envelope. Let's see this outer soft tissue envelope. So this outer soft tissue envelope is a very important part for the prognosis of the surgery when we explain to the surgery, because there are certain important surgical landmarks that related with this outer soft tissue envelope, and the blood supply part is also important of this soft tissue envelope, because during the plane of the dissections and during the so many other things, that is also important. So first we discuss this outer soft tissue envelope and the important surgical landmark that we have, that you have to know during the rhinoplasty, regarding the rhinoplasty. So the So the important surgical landmark regarding the bony vault, that is the first, that is the glabella, that is the radix. So radix, that is the, what is the radix? Radix is basically is the root of the nose and the starting point of the nose, and radix is the distance of the frontonasal suture. So this radix is the root of the nose and the first part of the nose. On the radix, the deepest point in this radix, that is the nasion. So nasion is basically the upper limit for the when we do the osteotomy, then we see for the transverse osteotomy. Yes, yes. अच्छा, थोड़ा सा इसको ऊपर कर देना, थोड़ा सा ऊपर करना है इसको एक बार, फिर बाद में करना है. So now is fine. Okay. So radix is the root of the nose and the starting point of the nose. Glabella is the not first part of the nose. Glabella is the most prominent part on the profile view on between the eyebrow. And then the other important surgical landmark regarding the bony vault, that is the rhinion. So rhinion is a osteocartilaginous junction between the bony part and the cartilaginous part. So two important points regarding the rhinion. One is the K area. So what is the K area? K area is basically confluence of the four structure, that is the nasal bone, upper lateral cartilage, and the perpendicular plate, and the cartilaginous septum. So in the K area, basically the attachment of the K area, in attachment the distal part of the nasal bone and the proximal part of the upper lateral cartilage. This upper lateral cartilage is on under surface of basically on the distal part of the nasal bone. So the overlapping in the K area is around the 9 millimeters. So this upper lateral cartilage gets the maximum support from this K area. That's why we always maintain the integrity of the K area during the rhinoplasty, especially during the crooked nose when you do the medial osteotomy. But if you go on the laterally, on the lateral side, then this overlapping between the upper lateral and the nasal bone, that is the less. So this central attachment in K area is important, because once this area is disrupted, then it's very difficult to reconstruct by the K wire or by the suture. So you always maintain the integrity. Another important thing on the in this rhinion area, the skin thickness. If you compare the skin thickness on the dorsum, then the skin thickness in the rhinion area is the thinnest, and in the nasofrontal area, that is the thickest. If you come down on the tip area, that is the highly variable due to the sebaceous content in the soft tissue envelope. So these all things are the important. Now the other other surgical landmark regarding the mid vault, that one, the upper lateral cartilage have the medial part, medial most part of the upper lateral cartilage that attach with the septum. So this attachment with the septum that have a specific configuration around the 10 to 50 degree angulation. So this is the internal nasal valve area. So this internal nasal valve area we always maintain or recreate after the hump excision or other maneuver. And the lateral most part, another important area regarding the mid vault, that is the Webster triangle area. So where because this upper lateral, once we open the nose, that you see the lateral most part of the upper lateral cartilage that doesn't have the sound attachment, that attached with the lowest most part of the piriform aperture just as a wedge of triangular bone. That is the Webster triangle area. So during the osteotomy, if that area you damage, then this lateral most part of the upper lateral cartilage is free, and the upper lateral cartilage, lateral most part is medialized. Consequently, later the patient have a nasal blockage, because on the same side the head of the inferior turbinate is also attached. So we always maintain, we preserve the Webster triangle area. Then next, the important surgical landmark regarding the lower vault. So for better understanding this lower vault, we can divide in the 4 subunit. First, this most anterior projecting, यहाँ focus करना. This most, बस, okay, fine. This most anterior projecting area, that is the tip, and on either side of the tip lobule, this free fibrofatty tissues, that is the ala, and this vertical column-like structure that divide these two equal nostril, that is the columella, and just this lateral to columella and medial to the ala, this is the nostril cavity. So for better understanding, for simplifying for the learning, we can divide in the 4 subunit this lowermost vault. Now, the important landmark regarding the tip, there is 2 light reflecting area on the tip, that is the tip defining point on the anterior surface of the on the tip. So the distance between the tip defining point, that is the width of the tip. Okay, and where the dorsum end and the tip start, that is the supra tip brake, and where anteriorly where the tip end and the columella start, that is the infra tip brake. So these 4 points, the tip defining points, supra tip brake and the infra tip brake, that have a relationship. So if you met all these points, then there is a 2 equal equilateral triangle. For aesthetic pleasing appearance, this superior half of the triangle and inferior half of the triangle, that is the equal. Now on either side, this ala have that 2 part, this free margin, that is the ala margin, and the attachment of the ala with this upper lip and cheek, this is the ala base. So this free margin, the curvature of the ala, if more than this ala facial junction, that is the ala flaring, and the distance between this ala facial junction, that is the width of the ala base. So this is the importance of the anatomy. If you know the normal anatomy, then you judge about the abnormal anatomy. So without know the normal anatomy, you cannot judge exact amount of the abnormal pathology or abnormal anatomy. So now the next, this vertical column like structure, the columella have the 2 parts. This is the pillar of the columella and this is the base of the foot plate of the columella. So this foot plate of the columella, that consists by the foot plate part of the medial crust, that basically rest on the fatty tissue on the antenasal spine area, and this pillar part, that is the basically maximum support part of the tip. Now on either side, this nostril cavity have the 2 important landmark. This posteriorly cylindrical area, that is the sill of the nostril, and on the apex of this nostril we have this soft triangle area. So in this soft triangle area, very dense to dense skin approximation, there is paucity of subcutaneous tissues, because in soft triangle area, when we open the nose, then we see basically we have the in the dome part we have the notch in the cartilage. So this part doesn't have the good support. So if during the marginal incision, if in this part you have there is injury, then the post-operatively it's very difficult. The patient develop a notch, and the notch is very bad in this area. So you always, when you put a marginal incision, then you always take care during in the soft triangle area when you make a marginal incision. And now this seal part, if you want to reduce the size of the nostril, then you excise this seal area. And if you want to reduce the flaring of the ala margin, then you excise this ala base. So this is the importance of the basically the anatomy of the nose. So we discussed about the important surgical landmark of the soft tissue envelope. Another important thing in the soft tissue envelope, that the blood supply of this soft tissue envelope that nourishes the entire nose. So the blood supply of the soft tissue envelope that come from the two system. One is the ophthalmic artery system and another the facial artery system. From the ophthalmic artery system, we have the terminal branch of the ophthalmic artery, that is the dorsal nasal artery, basically that emerges on the medial most part of the orbit and run over the dorsum. Run over the dorsum and the supply the upper part of the nose. And another from the facial artery system, from the facial artery systems at the angle of the mouth, this facial artery divide in the two part. Thoda sa yahan niche karna. This facial artery at the angle of the mouth that divide in, one is the superior labial artery. The superior labial artery run over the lower part of the lip, and at the level of the columella it gives some branches, that is the columella vessels. And another important branch from the facial artery system reach at the level of the alofacial junction, and at the alofacial junction it gives some branches, that is the lateral nasal arteries. So branches of the lateral nasal artery and branches from this dorsal nasal artery have there some anastomosis in this mesh layer, that is the subdermal plexus. And some branches of the lateral nasal artery and some branches of the columellar vessels, they have also anastomosis at the lower part of the caudal margin of the lateral crust, that is the LR card. So LR arcades. So this is the blood supply of this soft tissue envelope. But why we know the blood supply? What is the importance of this blood supply? Especially my junior colleagues, the blood supply, the importance of the blood supply during the medical rhinoplasty, during the filler injection. When you inject the filler, especially in the nasofrontal area, then the filler, the filler have the retrograde embolization through the anterior and the posterior ethmoidal artery, and the filler ultimately reach in the central artery of the retina, and consequently the patient developed the blindness. And really in a study, that 38 cases reported in the blindness. So because the central retina artery is the end artery, so sometimes you develop the disaster complications. So you have to know what exact depth where you infiltrate the fillers. This is the importance of the blood supply of the nose. Another important thing, during the transcolumella incision in open approach, we have this disadvantage, because when you open the nose, when we make the incision the transcolumella, then you have the injury in the columella vessels. So now this blood supplies of the entire tip is dependent by the lateral nasal artery. So when you make an incision for the ala base excision, then your incision is not more than 2 millimeter outer than this, otherwise you injured this lateral nasal arteries. And another one more importance during because in Indian patient we have a very thick skin, so during the defattening of the tip skin, if you do the overdo work, then you damage this subdermal plexus also. So these are the importance of the blood supply. So we discussed one part of the soft tissue envelope about the surgical landmark and the blood supply of the nose. Now